I'm a veterinarian and I work at VCA Loomis Basin, where we see both general practice and emergency small animal patients. At this hospital, we primarily work with dogs and cats. Most of us work, I would say, 3 to 4 days a week, typically 9 to 10-hour shifts, and then potentially have to stay later, depending on if I have a surgery to do or lots of records or things like that. ER, you can have a 7 to 4 p.m. shift, swing shift from 10 to 7, and then doctors at this facility who work like 7 to 2 a.m. or 7 to 7. So today, my day is gonna look like I'm gonna be seeing general practice appointments, some of my long-term clients in the mornings. That's my schedule today, but it definitely changes every day, which is what makes it so fun and exciting. Hello, hi, how are you guys doing?
Fine.
Good, how's Rudy?
I think he's doing okay. He still has his seizures.
How does he act afterwards? Does it take him a while to kind of rouse and go back to normal?
I got you, big boy.
It's okay. It's okay.
Rudy.
It's okay, Rudy. Hi, you're okay, honey.
Good boy.
I know, it's so much things happening. So for my veterinary journey, I went to UC Davis and studied animal sciences for my undergraduate degree. And then I was lucky enough to get into the UC Davis veterinary program, which was another 4-year program. And from there, did a 1-year internship in small animal emergency and internal medicine, where you rotate through this hospital. And then I was signed off as an associate veterinarian now. I decided to be a veterinarian, like most of us, at a really, really young age. You have like this passion and love for animals. I remember my mom used to bring home like sick wildlife into our house, like little birds and things, and we would nurse them back to health or take them to the wildlife center. So we're about to go see our next patient. His name is Nico, and I saw him 2 weeks ago for an ear infection and some really itchy skin. So hopefully he's doing better on the treatments that we had, and we'll go find out. How was doing the ear medications? Did he tolerate it okay?
Yeah, he responded well to the medicine, so we could tell right away that
That it made a difference?
the inflammation went away right away.
Good.
I mean, within the first hours of putting that medicine in.
Okay, can I take a little sample, honey? You're such a good boy. His right ear is still a lot dirtier than the left ear, so we need to continue to do an ear flush routinely, but he shouldn't need the antibacterial ointment anymore, which is awesome. Hey, I have a trivia question for you. What are a few different types of veterinary jobs that are out there? We'll have that answer later in the video. One of the biggest skills I would say to have as a veterinarian is communication skills. You are working with people when it's some of the hardest times and challenging times of their life, especially if you're working on ER or dealing with quality of life exams. And having empathy, to really empathize and put yourself in patients' shoes and the owner's shoes, can make so much of a difference on your interactions, your relationships with staff and clients alike. Hi, sweetheart.
So
Hello.
She's in today for vaccination.
Okay. So I always try to desensitize them a little bit before I actually poke. Good girl. Wow.
Good.
You did so good.
Yeah, she didn't even flinch.
She didn't. I swear, the cheese works. Definitely in vet med, you're dealing with scared animals, dogs, and cats. We're bringing them into an environment where they don't know the smells, they don't know the sounds. So it's really important to, be cognizant of that and try to respect them as much as possible. So we really encourage veterinarians to try to, learn the best practices for fear-free and make their patients as comfortable as possible. And really try to put yourself in their shoes, because it's a scary time for them as well. What I love most about being a veterinarian is that I can go home each and every night and really feel like I'm making a difference for my community, and that I've dedicated my life to something that I think is worthwhile. And I'm hoping that I'm bringing joy to people's life. I can be saving patients and doing overall good for patients. Definitely one of the hardest parts about being a vet is the emotional toll it can take on you. Having to walk into your next appointment where it might be a quality of life exam for owners who have had this pet for years. Mental health is such an important issue in the veterinary community that I think a lot of people don't know about. So being able to have those days off to really kind of bounce back, find ourselves again, and kind of deal with the emotions of the week is really helpful. If you're looking to going into the veterinary field, get some experience in one way or another in a veterinary kind of environment, it's really important to immerse yourself in the field and really decide if it's something that you want to dedicate your life to. If you are looking to go into vet school or kind of going down this path, believe in yourself. I know during undergraduate, a lot of the professors would tell us that how many of us want to be vets and only a very small percentage will actually make it. And it was really disheartening. I thought about changing my career path numerous times. But I assure you, if it's something that you're passionate about and something that you really want to dedicate your life towards, it's definitely achievable. So just don't give up on yourself. Thanks for watching. Be sure to like and subscribe to our channel, and we'll see you next time. Get out the awkwardness. Okay. See, we're so awkward.
I don't know. What am I supposed to say?